Hello and welcome back, our dear viewers. Today we are diving into a fascinating topic that touches the lives of many, the journey of healing, recovery and wellness. From the moment of an injury occurs to the stage of a treatment, rehabilitation and eventually returning to normal life. Physical therapy plays a crucial role in restoring both body and mind. Joining us today is Dr. Ahmed Alharbi, consultant physical therapist and medical health resorts specialist with years of expertise in rehabilitation, medicine, and therapeutic spa treatments. Dr. Ahmed will guide us through the process of recovery from hospitals and specialized centers to the unique world of medical and wellness spas. Dr. Ahmed, we are delighted to have you with us here in the show. Good morning to Kuwait.
Good morning, Kuwait. Nice to having me with you. Thank you.
Of course, it's our pleasure. Before we dive into the topic itself, I know there's a lot of misconception people will have about physical therapy. What one major one of them?
Physical therapy from several years, there is some misconception, but now I think everybody wants to become a physical therapist because we can have 80% of the problems of all the patients coming to our departments to be treated, from musculoskeletal or neurology or as you know, to pediatrics, children, to gynecology and obstetric, that means women's health, till diabetes and cancer. We are contributing in treatment of all these cases.
That's very awesome, inspiring a lot of generations who would like to take the same path. And regarding muscular, skeletal, and also some injuries, from that into the willingness and full recovery, that's such a quiet journey. Could you describe it for us?
From injury, the patient, he don't want to be only treated. Sometimes he needs some social and support, during the journey of recovery. So he should go for different stages, not only one stage.
So it's not like just giving you a medicine or maybe the treatment itself and that's it. There are different stages to it.
Yes. Let's go for first stage. Sure. Any patient for any problem,
okay,
he will go to the polyclinic, in Arabic, the al-mustawsaf. So in any clinic, a primary care clinic or polyclinic, doctors see him and maybe they give some medicine, maybe they also give him some advice to reassure him. If the cases persist and he didn't become well, or the case is strong, he should
severe.
Go to hospital.
Hospital.
So the second degree will go to, referring to the hospital. Hospital make more sophisticated diagnosis like okay, MRI, CT scan, laboratory tests to clear what is the reason, what's the diagnosis, and maybe start some preliminary
treatment plan,
physical therapy treatment also.
That's really good. So there are several stages going from the small clinical for something basic, and if developed, they go to the hospital to do the treatment.
After discharging from hospital and the case become stable.
Yes.
What the meaning stable means to you?
Stable, there's no more injuries, we reach the safe level that we can do the daily practices without any worries.
Yeah, the more stable the patient after getting out from discharging from hospital, he will go to two directions. Stable means stable in the vital signs like blood pressure, pulse rate, respiratory rate, and quality of respiration, and blood sugar. If they are stable, he can go home to become better, and his movement is better. But usually after hospital, if the case is still need more attention, we have two directions.
Okay.
We will go for therapeutic spa for recreation, or sanatorium, or what we call it, rehabilitation center.
So just to clarify it for the audience, when they hear like the word spa is associated with like massage and relaxation, is that the idea, or there's something more
Yes.
going there?
If you go for a recreational spa for cases like tension, hypertension, or some pains, the recreational spa, they can get hydrotherapy, treatment of water, and physical therapy, and massages, and swimming pools. So the patient will get in recreational stage, and to take his residual pains or problems and become well. For the other cases which have
Like even more sophisticated?
like RTA, road traffic accident, after surgery, or hemiplegia, the paralysis,
Okay.
they will go for rehabilitation center.
Rehabilitation center.
It is two routes, one here or here. The doctors will
Depends on the
decide.
case and the analysis of
Yes.
the patient.
For rehabilitation center, there is more physical therapy, there is more medical doctors care, there is more equipment and advanced equipment, even assisting in walking. So they will go for more technology and more techniques to try to help the patient get.
Restore their energy.
He can go for home safely. Because till now he need this rehabilitation stage. It will become rehabilitation center and so specialized. They will give him the assurance, and not only physically, also emotionally and spiritually also.
That's really amazing. And what does like the rehabilitation center plays in the recovery of the patient itself?
The patient, let's go for one case at least, like hemiplegia, the half of body paralysis.
Okay.
The patient cannot make a lot of things at home, so we want to rehabilitate him to do the activity of daily living, ADL, activity of daily living, like he can comb his hair, he can go to the shower
Change
alone,
his clothes.
independent.
Independent.
You can take on or in the clothes
Without assistance? Like
without assistance as much as possible.
Wow. Okay.
Because some cases will still need more stages. So till rehabilitation, there is also the types of spas and centers, and because even when we go for spa or resorts, medical resorts, there is some classification of types of health and wellness resorts.
Of course. And since we are talking about like health and wellness, one part of it, beside like the body, is also like the mind. Some people, they might see there's like limited hope, and you as a like someone who's expert, you can see there's potential for full recovery. So how can you like motivate the patient and make them like feel they can really recover like mentally?
That's a very good question, because motivation and giving hope for even in Instagram or Twitter or all these social media, we are speaking.
Exactly.
So sometimes there is some doctors have another opinion against me, so they said, don't mislead the patient. I said, how? He said, don't give him hope. Hippocrates, the father of medicine, he said, don't harm the patient. If you tell the patient there is no hope for you, you are killing the patient.
Exactly.
So your main rule is giving hope for the patient. I'll give you example. There is some cases I worked before in Amiri Hospital. There is some cases of paralysis, and some cases are difficult to treat. Old man, and he can spit on you, he can shout on you, he don't want to be treated. And it's easy for us to write uncooperative patient.
Exactly.
And
just
we
leave
will
the door.
stop according to his case. I was interested and amazed with these people, and I like to make them cooperate with me as much as possible. After a few days, they said, "Where is Dr. Ahmed? We want him. Where are you? Come, we need you." So it is the game of giving hope by different way. Use your intellectuals and let them become in hope, because he will get recovered quicker than the patient who's neglecting or he don't want.
That's really awesome how you transformed this patient who determined not to get treatment, and he was coming with a kind of angry mood, and you especially touch his heart in a way.
I will give another example, because this is very good for people. There's some, it's not my skills in how to treat, skills how to deal with the
being a human.
Yes, there is some other colleagues in some cases. The patient shout and make a complaint in the administration of the hospital, "I don't want this person come to treat me." So by name, and his family also. When I go take the history of the patient, not only the history of the disease, I'll take the history of family.
To understand the background.
What is his rank in the community? What is his background? So when I go for him, "Hello, how are you?" He's not responding, because he know I am physical therapist like the other one. He said, I will not speak with him about his case. I said, "Are you from this family? Are you working before in this country?" He said, "Yes, do you know me?" I said, "Yes, you are a great man, I like you."
Oh.
So then he can open with me.
Open up, huh?
He can be treated.
That's really awesome. I like how you transform the life of patients from strangers into people, and that show us that being a physician is not only about the skills that you have,
Yes.
but it's about being a human and having the communication key so you can touch and be relatable to the patient that you have. Thank you so much, Dr. Ahmed Alharbi. Unfortunately, we ran out of time, and I'm sure there's a lot of inspiring scenarios and stories, but hopefully for the upcoming episode next times. Thank you so much for being with us.
Thank you very much. I love media people. They are making us spreading our knowledge for the sake of customers and patients and people.
Of course, that's our duty here in KTV2 to support the people, the expert, and give them the spotlight that they deserve. Thank you, our dear viewers. We're going to take now a quick break, and then we're going to be back. Stay tuned.